bit miserable weather for Fiji. The weather should clear up pretty soon, hopefully. Ow, what was that?
Oh, good morning, sir.
Good morning.
Right this way, please. Just to the desk, thank you.
I have a 10:30 appointment with Dr. Livingston.
Alright, great. Do you have a Medicare card? Thank you so much.
Okay.
Yeah, just feel free to take a seat, sir.
Okay, cool.
Let me just get down some...
Excuse me, do you have a bathroom by any
Oh
chance?
yes, just door at the end of the hallway, sir.
Thanks.
Dr. Livingston is now ready for you, sir. Just
Oh.
follow me, please.
Thank you.
It'll just be a minute, but if you would take a seat here, please.
Okay, cool.
Yeah, he'll be on his way.
Okay, thank you.
Mr. Stevens, is that right?
Yeah, it is.
Nice to meet you.
Nice to meet you too.
So, Gus, what's your problem today?
I've recently come back from Fiji and I've been feeling very ill. Could you do some preliminary tests to see what it is?
Have you been experiencing any of these common symptoms, such as high fevers, diarrhea, and vomiting?
Oh, sorry, do you have a sick bag by any chance?
Here you go.
Oh, excuse me. Yes, I have indeed been experiencing those symptoms.
Okay, I'll now commence some preliminary tests. The first test I will do is check your temperature to see if you've been experiencing any high fevers.
Okay.
Quite high. Also seems that you've been sweating quite a bit. Here's a moist towel to cool you down.
Thank you.
Next test I'll do is check to see if you have any yellow tinge around the bite.
Okay.
Certainly a bit of yellow around the bite. This means there's a lack of red blood cells in the air and it's a common sign of malaria. But don't worry yet.
Okay, all done?
No, just need to do a body check for an enlarged liver or spleen. Definitely seems to be some swelling in the liver and spleen area.
Doc, what does this mean?
Nothing is for definite yet, but we'll just have to run some diagnostic tests. For the diagnostic test, I'll need to take a sample of your saliva and of your blood to send to the pathologist for examination.
Okay.
First, I'll take a sample of your blood. There it is. That should be good. Next, I'll need to take a sample of your saliva. Could you please spit in this cup?
Okay.
Great. Now I'll send these off to the pathologist for further examination, and I'll get back to you in a few days.
Okay. Thanks, Doc. Goodbye.
First, let's look at the blood sample for any parasites. That test was slightly unclear. Now let's do a DNA test. Right. I have to send these results away to Dr. Livingston.
Dr. Livingston.
Welcome back, Gus. Doesn't seem too good. The results have come back and it seems you've been infected with the Plasmodium parasite. I'm going to tell you about how you've contracted the infection, and you've been infected with the Plasmodium parasite, which is a pathogen. Basically, it's a virus or an infection. With me so far?
Yeah.
Great. So the pathogen is transmitted when an infected female mosquito bites you and then allows the parasite to enter your bloodstream. The parasite then incubates for a time period of between 6 to 16 days, which is a period you have experienced. They then start to attack your red blood cells and the disease spreads around your body. Does this sound clear?
Yeah, that all sounds pretty clear, but how is the mosquito infected and what are the impacts of having malaria?
The mosquito has probably been infected from its previous meal when it's bitten a person also infected by malaria, and then it has been infected as well. This has happened when the mosquito comes to bite you now. The infected blood inside mixes with the saliva of the mosquito and then enters your bloodstream. Now, you've been experiencing most of the short-term effects with the Plasmodium parasite. If a patient has severe malaria, they may suffer some neurological effects, which may lead to abnormalities in the brain.
Oh no, do I have severe malaria?
Gus, you've been extremely lucky and have not been infected with the type of malaria that causes life-threatening consequences. But you've been infected with the Plasmodium knowlesi, which causes much less worse consequences.
Wow, what a relief.
And now I'll refer you to my old friend, Dr. Oates, for the treatment.
Oh, Mr. Stevens.
Dr. Oates, how are you planning on treating me today?
Oh, let me just get my file. I'll be supplying you with 5 methicillin tablets that you take over a course of a day, optimally tomorrow.
What do I do if the medication is ineffective?
If symptoms do not increase within 48 to 72 hours after taking the last tablet, immediately come back for retreatment.
How does this medication have an effect on my malaria disease?
This type of medicine works by interfering with the growth of the parasite within your red blood cells.
Are there any side effects suffered by this medication?
Yes, you may suffer these common side effects after taking this medication. Stomach pain, dizziness, muscle pain, fever or skin rashes, but nothing is definite. Here is the medication.
Thank you. Have a great day.
You too, Mr. Stephen, and remember, if the symptoms do not die down, come back for retreatment.
Okay, thank you.